Number one, test your hormones, especially if you're someone who's not having symptoms. So if you're a woman who's in her 20s or 30s or even early 40s, you don't know what we're talking about with all this dysregulation stuff, measure your hormones, because knowing what they look like when you feel regulated is really helpful later on. So measure your hormones, do it in a blood test, do it in a dried urine test, do it in a saliva test. Number two, I think it's critical to personalize your food plan. I have a food first philosophy. We tend to be the kind of culture that reaches quickly for a pill, for metformin, or for even berberine, kind of a natural solution for insulin resistance. And I think we forget how much food can influence our body.
Hi, I'm Dr. Thais Aliabadi.
And I'm Mary Alice Haney. Our guest today, Dr. Sara Gottfried, is an expert in personalized medicine and hormonal balance, as well as nutrition and behavioral practices that help women navigate their hormones and longevity.
She's a Harvard-educated medical doctor with 25 years of experience and the author of 4 New York Times best-selling books. Thank you for joining us on SHEMD.
So today I am so excited to have Dr. Gottfried on our podcast. I have to tell you that I have been following you and I've read every single one of your books. She has 4 New York Times bestsellers, and I'm going to get into all of that. But I think you were the first person that I noticed in the health space that was really talking about women in a 360 way and talking about women as, not just giving medicine and hormones, doing, using both medicine and also naturopathic things and sort of combining them all. So I don't remember what podcast it was, but I actually emailed you. This is I'm such a fangirl. I really am. I think I was still had my fashion line, but I emailed you just saying, thank you so much for what you're doing for women, because it was really told to me in a very easy to digest way. And so I have to say, I'm just so thankful that you're on our podcast. And here we are years later that I get to sit here and interview you is just amazing. So thank you for being here today.
Oh, what a thrill. So happy to be with you both.
And I'm just going to talk about you a little bit, so you're going to have to get embarrassed. So you did your undergraduate training in bioengineering at the University of Washington in Seattle. Then you completed your medical training at Harvard Medical School. You're now a clinical professor of integrated medicine and nutritional science at Thomas Jefferson University. You have been a physician treating men and women in various aspects of hormone health and longevity for more than 20 years. When I was doing some more research, one thing that I love that you say that you leverage personalized medicine to become a more awakened physician, leader, teacher, and 4-time New York Times bestselling author. Your books include The Hormone Cure, Younger, Women, Food, and Hormones, and then your new one is The Autoimmune Cure. So I just would love to start by just your journey, because as I know, and I'm sure the listeners are going to want, what happened? You call it McMedicine. You're practicing McMedicine. You're in your 30s. Your cortisol levels are going through the roof. What was that aha moment for you where you said, "This is not what I want to do anymore, and this is not how I want to treat my patients"?
That moment when I turned left. So I had this kind of training that I imagine is similar to DR.A.'s, where we were trained to be conventional physicians and to take care of women. We're both board certified as obstetrician gynecologists. But when I was in my mid-30s, I had my first child. And I remember feeling postpartum, struggling with sleep, struggling with weight loss, and going to see my primary care doctor. And I had a list of woes. I had no sex drive. I just had a hard time getting through a full day of seeing patients. I was seeing about 40 patients a day at that time. And I remember my primary care doc said to me, "Well, it sounds like you might have some depression. Why don't you take some Prozac? And it also sounds like your issues are hormonal. So why don't you go on the birth control pill?" And it was just one of those aha moments where I realized, okay, if I'm a doctor and I'm struggling with these things, there are millions of women who are also struggling with this. And I don't think a selective serotonin reuptake inhibitor is the answer. So I went to the lab, I ran a panel of hormones, and that's what really started all of this because I found that my cortisol, the main stress hormone, was 3 times what it should be. I had estrogen dominance, too much estrogen relative to progesterone. I had low DHEA. I had the kind of picture of a woman who was maxed out. And so I realized that the solutions were not there. In my board certification, I was board certified in everything that could go wrong with the female body. And I wanted to become board certified in everything that could go right with the female body. So that's what lit me up and got me on this course.
This is amazing. As you're talking, when patients go to the physicians, to OBGYNs, the number one thing they get diagnosed with is anxiety and depression. And the second thing they get prescribed or the first thing they get prescribed is a birth control pill. It seems like when we don't know what we're doing, we always go to birth control. And I couldn't agree with you more. It's so hard. I don't know why it's so difficult for female patients to really get diagnosed at the core without being prescribed these medications automatically.
It's not easy to talk about cancer, yet knowing your family's history of cancer is a first step to understanding your own risk and may qualify you for genetic testing that can help inform your way forward. The MyRisk Hereditary Cancer Test with Risk Score from Myriad Genetics is a powerful tool to help healthcare providers identify your risk of developing 11 different types of hereditary cancer. And Risk Score analyzes multiple factors to estimate your risk of developing breast cancer over the next 5 years and remaining lifetime. Breast cancers can be missed on annual mammograms, especially in women with dense breast tissue. And some patients may benefit from more advanced screenings like an MRI. MyRisk with Risk Score can inform decisions about additional screening methods, which may find cancer at its earliest, most treatable stage, or even prevent it. Knowing your cancer risk can be just the beginning of more personalized care. Learn more about MyRisk with Risk Score at getmyrisk.com. That's GETMYRISK.com. And so walk us through a patient's journey with you. And I'd love to know sort of what you're known as the hormone guru. I mean, your first book was all about women and hormones. And so I'm your patient. I say, hi, I'm lucky enough to come to your office. What do you do?
In precision medicine, what we typically do is start with your story. I mean, all doctors do that, but we want to hear, what are the issues that you're bringing to the table? What are your values? What are the things that are causing the most distress in your life? So I hear your story, Mary Alice, and then I'm going to put it together with your genetics. So I do genetic testing on pretty much every patient unless they don't want to do it. And then I do extensive biomarker analysis, meaning blood testing, stool testing, hormone testing, and that's a combination of blood and saliva and urine. So that's where we typically start. And depending on what the goals are, I see a lot of executives and their goals are related to career longevity and to performance. I also take care of the Philadelphia 76ers. And so their issues are more around how do I gain muscle? And then I take care of a lot of perimenopausal women. And the main thing that they typically want is regulation. And just, Dr. A, as you were describing, when we don't know what to do, often we reach for a treatment for anxiety, the Xanax, the sleeping pills. We reach for the birth control pill. And I think what women often are feeling, what they're bringing to the table is this state of dysregulation. I almost think of it as we live right now in the United States of dysregulation, that we need to find ways to help women feel more regulated. And there's good reason for it. Typically sometime around 35 to 40, women start to notice that they can't roll with the punches the way that they once did. Their cortisol, their stress hormones are not quite what they were in their 20s. They don't bounce back after having a baby like they used to. The ways that they used to manage their weight don't work anymore. And these are all symptoms of dysregulation. It could also be, sugar cravings the week before their period, night sweats, hot flashes, insomnia, depression. All of these are symptoms of dysregulation, and 80% of women experience these starting around 35 to 45. So that's perimenopause. It's something that all of us go through, and yet we don't talk enough about it, and women aren't offered the kind of solutions that really make a difference.
Can we go back to, you said biomarkers in the blood? What biomarkers are you checking in blood, in urine, and in stool?
What I typically start with is an advanced cardiometabolic panel.
Mm-hmm.
So I find that we know right now that about 88% of Americans have some level of metabolic dysregulation. So that could be a sluggish metabolism. It could be one of the 5 criteria for metabolic syndrome. And so I do advanced biomarkers related to things like not just, the typical cholesterol panel, but looking at LDL particle, fractionation of LDL, HDL particles, oxidized LDL, myeloperoxidase. I'm doing a measurement of how much inflammation is in the body. So most people have heard of high sensitivity C-reactive protein, but there's other markers that you can look at, like a neutrophil to lymphocyte ratio when you look at white blood cell count. I also do a basic hormone panel. So I'm looking at cortisol, estrogen, progesterone, testosterone, DHEA. And then in the urine, I'm looking at the metabolites of some of those hormones. And that becomes more important when women are in perimenopause and we start them on hormone therapy, because often you've got genetic variations that can make you at a greater risk of breast cancer, for instance. And so we can often use food and supplements to modulate which pathways your hormones follow as they go through the body. So those are some of the basic tests that I do. And then depending on what someone is experiencing, I often will run an autoimmune panel. I had this recent book, The Autoimmune Cure, and what was so surprising to me was that we looked at a group of 100,000 pretty healthy people who signed up for a particular lab test, looking at functional medicine labs that I'm describing right now. And out of this 100,000 people, 30% of them had positive anti-nuclear antibodies. 30%. So you may not think of yourself as having autoimmunity, but right now, 1 in 3 of our listeners, 1 in 3 of our viewers has antibodies against their own body. And this has risen exponentially in the past few decades.
And if you're one of those 3, what does that mean for you?
Well, I am one of those 3. So I tested myself and I had positive anti-nuclear antibodies about 5 years ago. And what it means, anti-nuclear antibodies are considered in conventional medicine, the medicine that I trained in DR.A, considered to be nonspecific. So it doesn't mean anything on its own, but it means that your immune system is attacking the nucleus of your cells. So your ability to distinguish normal, healthy tissue from an invader has become confused. So anti-nuclear antibodies are, to me, an alarm, an early indicator that you've got to turn the ship around. You've got to do something different with your immune system. So when it comes to autoimmunity, to answer your question, Mary Alice, the 3 things that I think of, the 3 things that are required for autoimmunity are genetic predisposition, increased intestinal permeability, so-called leaky gut, and then a trigger. And so you can do something about the leaky gut. You can do something about the trigger. Can't do much about the genetic predisposition. But that's where you can become empowered to do something like an elimination diet, taking immunomodulators like vitamin D, like curcumin. So there's lots that you can do to address this. In fact, I reversed my anti-nuclear antibodies.
With food and vitamins?
With food, vitamins, and the trigger is where things get interesting. So for some people, a trigger could be getting COVID. So we know that there's, this this long COVID phenomenon that we're seeing in patients, and there seems to be an autoimmune component to it. And for some people, it's trauma. So about 80% of people with autoimmunity have a history of trauma. And that was my experience. I have an adverse childhood experience score that's elevated. And so I did what I describe in the book, the protocol that I described in the book: elimination diet, immunomodulators, a lot of body awareness practices, and also psychedelic medicine. And that's a whole other conversation. Happy to get into it if you want.
We would love to talk about that. We find that very interesting. All of the, there's new ways of treating everything. Today's podcast is sponsored by MIDI Health. If you're a woman over 40 experiencing menopause or perimenopause, trust me, you're not alone. When I turned 50, I started experiencing all these symptoms I had never dealt with before, like hot flashes, brain fog, trouble sleeping, and just overall not feeling like myself. At a certain point, I was feeling pretty desperate. And that's one of the reasons I'm so passionate about interviewing doctors that can arm you with the information you need to be your own health advocate and feel better. If you're dealing with symptoms brought on by hormonal changes, you don't have to accept it as part of aging. A great way to start taking control of your health is by scheduling a virtual appointment with MIDI Health. MIDI clinicians are menopause experts who are dedicated to providing you with real solutions to the range of symptoms you may be experiencing. Everything from moodiness to weight gain to joint pain. Plus, if you're uninsured or Medicare is out of network under your plan, they also offer affordable cash payment for services. You deserve to feel great. Book your virtual visit today at joinmidi.com. That's joinmidi.com. I love living in Los Angeles, and one of my favorite things about it is the weather. It's rare that it gets super, super hot like it did when I was growing up in the South. But if you're like me and you're experiencing the joys of perimenopause, I'm willing to bet you're also dealing with those fun night sweats. And now that it's summer, that's certainly not helping anything. That's why I'm so glad I discovered Brooklinen sheets. It's no surprise Brooklinen makes the internet's favorite sheets. And they've earned their claim to fame with awards from Good Housekeeping and Wirecutter. Brooklinen helps me stay cool and comfortable throughout the night and has made a huge difference in how I sleep. I love how durable their products are. They keep getting better with every wash, which is perfect for a house full of kids. If you're looking for an upgrade in your sleep experience, Brooklinen is definitely the way to go. They have a bunch of different colors and styles to choose from, and it's such an easy way to refresh and revamp your room. There's truly nothing better than a good pair of sheets for a good night's sleep. So get the lightweight essentials necessary to upgrade your space for the summer at brooklinen.com and use promo code SHEMD for $20 off your purchase of $100 or more. That's BROOKLINEN.com. Or if you're the type of person that likes to feel your sheets, come into the store. I have a question for both of you, which is when you test for your hormones, you're testing at a certain time of day. So that could be a moment where your estrogen is just shooting through the roof at that moment, or it happens to be a day where it's low in your cycle. So how do you really test your hormones? And is it more symptom based or is it more blood testing?
Yeah, so Dr. A, I would love to riff with you on this. My experience is that it's both. You want to contextualize with what the patient is telling you. You want to look at the laboratory tests, but you also don't want to only look at the laboratory tests. So it's a combination of the two that I use. What about you, Dr. A?
So the way I look at it, it depends on, if I heard you correctly, it depends on what hormone you're testing for, right? Usually if we do, let's say, thyroid panel, you can do it at any time. If you're doing, if you have a postmenopausal woman who hasn't bled in over a year and you're checking hormones, you can do it at any point because they're not having cycles. In a premenopausal woman, if we want to check hormones, usually we do it day 3 of their cycle. If we check for FSH and estradiol. If you want to see if they're ovulating, you do day 21 progesterone. So it all depends on what hormone you're trying to test for. Does it make sense?
Yep. And then is dried urine testing, is that a way that you test as well? I read something about that.
So I use all methods of testing for hormones. I think for specific hormones, there are some tests that are more proven than others. So blood testing is the universal language of physicians. I like to build bridges with other physicians, so I do a lot of blood testing, but there's limitations to blood testing. So, for instance, it is the gold standard when it comes to thyroid testing, TSH, free T3, free T4, sometimes reverse T3, and then antibodies to the thyroid peroxidase, and antithyroid globulin. But when it comes to cortisol, in the blood, you can measure total cortisol, but you can't measure free cortisol, which is what's biologically active. So again, this is the stress hormone. So you want to know total and free. So I often will start with blood testing, and then I'll use either saliva or dried urine to look at the level of these free hormones, such as cortisol, estradiol, the main estrogen that you make in your reproductive years, progesterone, testosterone, DHEA.
And so then you have a woman, you've tested her hormones, your labs come back, you've talked to her. And so how do you decide whether, do you put your clients on traditional hormones like an estrogen patch and progesterone pills and testosterone? Because I know you also, I mean, in your book, Women, Food, and Hormones, you use, non-traditional hormones. I mean, non-traditional things like food to also change your hormone levels.
There are some hormones that can be modulated with food. Probably the most famous is insulin, but there's others too. So testosterone, growth hormone can be influenced by the kind of food that you're eating. But when it comes to women who are in perimenopause, who are in that dysregulated state that we're talking about, and I'm someone who's been in perimenopause for 20 years, so I'm very familiar with this phenomenon, there's a time and a place just to start hormones. So when you ask about traditional hormones versus maybe bioidentical hormones, what I think about is what is the most structurally similar to what a woman has always made. And so I tend to use bioidentical hormones. It's what makes the most sense to me. Although I was taught originally to prescribe Premarin and Provera when I went through my training 30 years ago. So I haven't prescribed those things for a long time. I learned when I was writing the hormone cure that Premarin, it was the number one prescription in the US given to women who were perimenopausal and menopausal for about 59 years before we did a randomized trial and showed that it was somewhat risky, that it was associated with a greater risk of heart disease and with stroke, something that we weren't aware of when we were handing it out, almost like candy to women. So I tend to start with transdermal estrogen. I think that's got the safest profile. I use a lot of patches, and I think given the range of doses that we have, you can take care of a lot of women's dysregulation with a combination of a estradiol patch that's FDA approved. So it's got regulatory support behind it, together with natural progesterone, micronized progesterone. So that's where I typically start.
Let me ask you a question. If you have a premenopausal woman, and I agree with you, especially when you do patches, it doesn't have the risk of blood clots that come with oral estrogens. But let me ask you, when you have a premenopausal woman, premenopause means that she's not going through menopause. I'm just giving, or she's not menopausal yet. Definition of menopause is no period for a year. But let me ask you, if you have someone who's already getting her cycles, but she has all these menopausal symptoms or premenopausal symptoms, do you cycle them? So do you give them like the estrogen patch for, 25 days with progesterone, and then you drop both for 5 days? Or how do you treat your patients? How do you cycle them?
So someone who's premenopausal or perimenopausal, I typically start just with progesterone. So I'll sometimes do testing to see where they are, knowing that in the first phase of perimenopause, when we check the day 3 FSH and estradiol, sometimes estradiol is fluctuating wildly. And so I often start with progesterone only because we know that giving progesterone is very safe. Micronized progesterone, the same as what you make when you're ovulating. And it helps with sleep. Women have double the rate of insomnia as men, and this is when it tends to start. So I often will start first with progesterone. And then if that doesn't seem to manage the symptoms, say they have depression, perimenopausal depression, that's when I'll add a patch or some other transdermal estradiol. How about you? How do you do it?
It depends. I usually do combination when they're symptomatic. And if they're cycling, I continue to cycle them on the HRT that I'm giving. So when you give them progesterone, do you give it continuously or do you do it for a few weeks out of the month?
So I usually start it day 12 to 26.
Right.
So I cycle them, and depending on how they respond to the progesterone, depending on what happens with their cycle, because often, as you know, their cycle's a little closer together. It's more like every 22 days instead of every 28 days. So if we can get them back to a 28-day cycle by cycling them with progesterone, that's my goal. So then we see what symptoms are still remaining, and I'll treat those.
And for all the days that they're off of it, do you give them 100 milligrams at bedtime?
I usually, if I'm cycling, I give 100 milligrams twice a day.
Got it.
Day 12 to 26. And I've got some women who don't tolerate that, or they've got bleeding. In fact, you and I share a patient that I just switched to slow release progesterone at 150 milligrams. So that would be a compounded version of progesterone.
And so you do that. And for the days that they're not on it, they're not having symptoms?
Well, that's what we're tracking for.
Got it.
So, for someone, for instance, who's got hot flashes and night sweats, we know that treating with estrogen is going to resolve 90% of their symptoms. And progesterone resolves 80%. So I think it's a good place to start, especially if you're not sure yet, if someone is in that place of, more wild fluctuation of estradiol.
You talk a lot about cerebral hypometabolism, which is slow brain energy. I call it brain fog. I mean, half of us call it. How do you treat that? And, I'm on hormone therapy, and funny enough, this crazy thing happened to me. So I'm somebody that thinks more is more. And so I was like, well, if Dr. A gave me this amount, I'm just going to slap another one on. And then all of a sudden I noticed that I was like, I was like really, angry, and I was, feeling like that. And I was like, well, maybe I need to get on a SSRI. Like all of a sudden you're, it's all this stuff. So,
and then you were using 5 patches on you at a time.
No, I was like, so then I was like, oh no, I said, my brain fog, what am I going to do? So, listen to your doctor and don't slap on 5 patches is really the moral to the story. But how do you treat cerebral hypometabolism?
Well, Lisa Mosconi has really led the charge in terms of understanding cerebral hypometabolism or slow brain energy. And the way I talk about it in my office with the patients is, do you find after 40 that you can't remember that word that's on the tip of your tongue? Do you walk into a room and you're not sure why? You can't find your keys or your phone. And so 80% of us are experiencing this after 40. And what we know is that the female brain is different than the male brain in many ways. But one of the key ways is that after 40, the same women that are having those symptoms of dysregulation, hot flashes, night sweats, insomnia, anxiety, depression, those women are having a change in glucose metabolism in their brain. So the brain is not taking up glucose and using it the way that it once did. And you can see this when you do PET scans and you label glucose in the blood, and then you look at the uptake in the brain. So from your 30s to perimenopause, there's about a 15% decline in the way that your brain uses glucose in 80% of women. And then there's another 5% loss in menopause. So overall, about a 20% decrement, which you can really feel because the brain is like a glucose hog. It just uses so much glucose. It only weighs about 2 to 4 pounds, but it uses a huge amount of glucose in the body. So when your mitochondria, those little power factories inside your cells in your brain, start to falter and you don't have as much estrogen to power them, they are not able to use glucose the way that they once did. So how do you deal with this? We're still in the early stages of understanding, but we think that this entire system is regulated by estrogen. So the answer seems to be use estrogen. Now, not every single woman is a candidate for taking hormone therapy, but many more are candidates than are currently being treated. Mm-hmm. So there's a real gap that I'm sure you also see, Dr. A, where because of the Women's Health Initiative and all the misinformation that came from that, for the past 20 years, women have just been scared to go on hormone therapy. And so they've been suffering and they've been living with this slow brain energy in a way that really dims our light and lets us, it keeps us from being able to achieve our mission and our purpose and our meaning. So I'm a big fan of treating it as early as possible. And it seems to be that the critical window, kind of the window of time to give hormone therapy, might be a little bit shorter with the brain in women compared to cardiovascular disease. So with cardiovascular disease, we think there's like a 10-year window where you could start hormone therapy up to 10 years after menopause, which on average is about 60, 61, 62. But when it comes to brain health, it seems to be a more narrow window. Like you want to start hormone therapy sooner in perimenopause or certainly within 5 years of menopause.
I believe for patients who carry the ApoE4 gene, I don't know if you check for that, it's a gene mutation for dementia. Correct me if I'm wrong. I think 20% of the population has one copy, 2% of the population, I have one copy.
I have one copy.
And 2% of the population carries two copies. So if you have the ApoE4 gene, it's a test that's available. It's covered by insurance most of the time. If you know that you have the ApoE4 gene, you will have benefits of going on HRT, like Sarah was just telling us, especially I believe the first 7 years of menopause. So the sooner you started, the more benefits you'll get from it. If you're older and you have no symptoms, you're in your 70s and you have the ApoE4 gene, then, I don't know that I would start you on hormone replacement at that age. But that's why it's good to know if you carry this gene mutation so you get treated right away. Obviously, hormone replacement is not for everyone. You need to talk to your doctors. You need to make sure you don't have any underlying condition that, make sure your mammograms are done. If you're at high risk for breast cancer, make sure you do MRIs. If you have dense breasts, make sure you do your ultrasound. But if you carry these gene mutations, if you have foggy brain, if you have hot flashes, depression, lack of sleep, and all the premenopausal symptoms, HRT really does make a difference. And I couldn't agree with you more. But in a setting of, you just have to make sure you pick the right patient for it. And like you said, a lot of women qualify. Unfortunately, I had breast cancer. So not only I don't qualify, I'm on an anti-estrogen. So you can only imagine I'm shocked that my brain functions this well.
Your brain is functioning at a high level. You do not suffer the same thing that I have. Let me tell you. I'm literally sitting there. I'm like, I can't remember my name. And she's, lifting. Now, when you have clients like Dr. A, are there some foods that you would recommend or things that they can do if they can't take estrogen?
Treat me, Sarah. I'm stressed out. I don't sleep.
Her cortisol levels. No, when I read about her, how she had 35, her cortisol, she had 30 patients a day. Like this woman sometimes doesn't sleep for 2 days, delivers babies. She's doing all these surgeries. Then I make her come on this podcast, and I'm like, your cortisol levels are through the roof. You have to be a better patient for yourself.
Sarah, I'm coming to you. I took the Boston heart test. I don't know if you're familiar with it.
Of course.
I failed every category of it.
Oh, dear.
The first page, I had the lipoprotein A. My ApoB was high. My inflammatory markers were off the chart. I had insulin resistance. I carried one gene mutation for ApoE. So, and I mean, fail throughout the test. But if you look at me, I'm like, I've never been overweight. I don't smoke. I don't drink. So fix me. Tell me, what do I do? Someone 53, I'm not overweight. I don't have high blood pressure, but I failed every category of that Boston heart test.
I remember when my kids were little, we used to read the book, Everybody Poops. They thought it was hilarious, but it's true. Everybody does poop. And I'm just happy that we're now all talking about our poops and what is not normal. Did you know that 80 to 90% of all Americans suffer from some type of gut issue? I know I do, and I learned so much from our episode on gut health and how important prebiotics and probiotics are. I'm always hearing about how important gut health is, but it's hard to know what the right products to buy are. And they are not all created equal. According to research, 99.9% of all probiotics on the market die in your stomach acids before they get to where they're needed, even the refrigerated ones. That's why I'm now taking Just Thrive spore-based probiotics. I don't have to worry about it because they are clinically tested and proven to arrive 100% alive in my gut. And I know they're safe for all ages, so my kids can take them too. Just Thrive Health also has an amazing product called Just Calm, which has really helped me counterbalance the stress in my life. Just Calm has a mood biotic strain, which is the most heavily researched and verified brain probiotic available. Just Calm has a mood biotic strain, which is the most heavily researched and verified brain probiotic available. In multiple clinical studies, it's been shown to help you effectively manage stress. For a limited time, you can save 20% off a 90-day bottle of Just Thrive probiotic and Just Calm at justthrivehealth.com with promo code SHEMD. That's like getting a month for free. Take control today with Just Thrive. To learn more about this groundbreaking company and all about your gut, don't miss our amazing episode with Just Thrive's chief microbiologist, Kiran Krishnan.
Okay, so let's get down to business because Mary Alice, you were asking me, okay, what do you do? A patient presents to you. And I was telling you generally, but it's much more fun when we actually have a person. So it's the same approach, genetics and biomarkers. And you've already done some of your genetics, Dr. A, so you know about your ApoE4. It sounds like you've got some other genetics that we need to pay attention to with that Boston Heart Lab that you're describing.
The lipoprotein little a, plaque formation.
Little a, which is the silent risk for heart disease.
Right.
It's what a lot of people don't know they have. So it's good to know that you have that. It can be somewhat difficult to manage with diet, but one of the first things I would do with you is to put a continuous glucose monitor on. I don't know if you've worn one of those before, but I would start with that. And I would start you on a Arona berry smoothie. So we would make a smoothie that has organic Arona berry in it, because that's been shown, at least in some people with elevated lipo(a), to help to reduce it.
What berry?
There's a few.
What berry is it? Arona berry?
It's called a Arona berry, ARONOBEERRY. Arona berry.
You better buy it from me.
I'll buy it for you.
So that's where I would start. And, there are some other genetics that I would want to know about, because you've got a really interesting interface that you're describing between your genes and your environment. And it sounds like you're someone who deeply serves your patients, sometimes at the expense of your own self-care. So just as Mary Alice was just asking, I'd want to know about your cortisol levels. I'd want to know about everything that we could modulate outside of estrogen, since that's not something that you could take.
But let's just say that her cortisol level is through the roof. What do you do? And most women, I would say most of us probably have, unless we're know it and are trying to deal with it. Because
if you're a mom, your cortisol
level.
If
you've got teenagers, your cortisol level is through the roof. We know that her cortisol is through the roof. So what do you do for women whose cortisol is through the roof?
Yeah. So when my cortisol, I measured it for the first time in my 30s, as I said, and it was 3 times what it should be. And I went to my mentor, Luann Brisendine, who's a neuropsychiatrist at UCSF. And I said, Luann, my cortisol is 3 times what it should be. And she said, yeah, every female doctor I know has a cortisol that's 3 times what it should be. So what do you do?
What is a normal cortisol? And you do it fasting in the morning. What do you like to, where do you like to see it?
So morning cortisol, I like to see between 10 and 15. In the afternoon, I like to see it between 6 and 10, because cortisol is kind of like a flower, like a gazania that opens and reaches a peak within 30 minutes of waking up, and then it's got a gradual decline throughout the day. So I look at what it is in the blood, but then I'm especially interested in looking at salivary levels, like what it is when you first wake up, 30 minutes later, 60 minutes later, and then at a total of 4 points during the day. So that really tells me about cortisol load and whether you've got a normal diurnal pattern or more of a flat pattern, which can cause more immune dysregulation and more dysfunction. It's more associated with anxiety. So I want to know cortisol levels in you, but I'd also want to know the pattern. So what do? This is where we need an a la carte menu of what you're going to do in your life to address your cortisol. So I'm someone who meditates every morning. I do yoga every morning. Not everybody wants to do that. I mean, people come to see me and they're like, I know you're a yoga teacher. There's no way I'm going to do that. So is meditation something you would consider, Dr. A?
I can, if I can shut my mind down, I would.
Yeah. I don't think that's
My
happening.
mind goes a million miles an hour. I'm doing like 20 things at the same time.
So that's what you have to do. You have to do something like
meditation, I can
mindful.
work on that. What else? Yoga, I can add that.
So yoga, meditation, do you know what your adverse childhood experiences score is?
No.
So we should figure that out. So we want to know if you have any trauma embedded in your system, because often trauma, and this is my experience now, I don't want to put you on the spot, but my experience was that I had to achieve to earn love and affection as a kid. And so achievement became part of like who I was.
Mm.
And I have to actively find ways to shift from the sympathetic nervous system, fight, flight, freeze, fawn, to the parasympathetic, which is where all the healing happens and where cortisol starts to return to normal. So there are some supplements that can be helpful, like phosphatidylserine.
I grew up with a lot of love, but I also grew up in war. So my childhood was in war in Iran. And then I came to America when I was 17, new country, knew everything. And then I had breast cancer. Otherwise,
there's no trauma.
Otherwise, you know what? I didn't even know I had trauma until I went to dinner with a friend of mine a few years ago. And I was telling everyone that I didn't have trauma. This was before my breast cancer diagnosis. And I was like, oh my God, I had such a great life. I've never had trauma. And he looked at me, he's like, you had a lot of trauma. You grew up in Iran during the war. You would go in the basement, you would hide in the basement. And when I came in the car, I was like, I guess I do have a lot of trauma. And I hate him for that, because now I can, I think I had just suppressed it somewhere down in my system. But I did, now that I look back, I did have childhood trauma, but I always had love. So maybe it was that love that helped me push all that trauma away. But go ahead and tell me so that was my background. I wanted to give you more history about myself.
Thank you for sharing that. This is a very common experience. I grew up with a lot of love too, and that does help mitigate some of the exposure to trauma. But there's also a way that trauma can live on. There can be a signature of trauma that keeps you revved up, keeps you in that cortisol on position, where it's really hard to shift to the parasympathetic, the stay in play state, as opposed to fight, flight, freeze, fawn. So being able to actively do that is really critical, and finding what does it for you. So for some people, it's dance. For me, it's meditation. There are kind of active forms of meditation that I really like. Right now, I'm experimenting with Joe Dispenza. I like his methods, and I'm really learning a lot from him. Orgasm, also very effective for helping to normalize cortisol levels. And then supplements. So you have to be careful with supplements, just like I don't think you solve the mental health crisis by reaching for a selective serotonin reuptake inhibitor. I think you need to do these lifestyle changes to have the biggest effect when you have a high cortisol. But that said, phosphatidylserine is one of the best. It's a plant-derived supplement that at 400 milligrams has been shown to lower cortisol. We also know that fish oil, omega-3, lowers cortisol. Sounds like you've got some increased inflammatory tone, DR.A. And so looking at your omega-3, 6, 9 balance would be important. So I also do nutritional testing in my patients, and I would advise something like that for you. And that would help to personalize your food plan together with the continuous glucose monitor so that we could reverse that insulin resistance.
And you talk about the microbiome a lot and that connection. There's so much right now between the connection of the gut-brain axis and how do you test that stool? I imagine it's stool testing. And what are you looking for, and how? I think, again, I kind of go back to this, especially Americans with the American diet, we've just really messed up our microbiome. And how do we fix it?
The microbiome we're still in the early stages of understanding we know pretty well how to diagnose problems. So what I'm looking for when I do a stool test, and I've got a lot of different labs that I use to do that. There's some that are direct to consumer, like Longevity has a good gut bio test. And then some you have to order through a clinician. What I'm looking for is dysbiosis, so an imbalance between the good bacteria and the not so good bacteria and other microbes. And there's especially certain microbes that are associated with autoimmunity. So I'm going to look for that in patients that I'm taking care of. We're also looking at gut function, like how are you doing in terms of breaking down foods, getting the nutrients that your benevolent microbes need, like short chain fatty acids, butyrate, that sort of thing. You want to look at how you're digesting proteins, how you're digesting fat. And then some tests also allow you to look at immune function and metabolic function. Some tests let you look for whether leaky gut is present. So, for instance, with my professional athletes, every single professional athlete I take care of has leaky gut. It's just a result of the intense training that they do. So, those are some of the things I'm looking for with the stool test. And then we can use food, we can use supplements to adjust and do rehabilitation with gut function. And it's really critical. A lot of people don't have any gut symptoms, so they think their gut is fine. But the gut is really the center stage of your total health. And so when you've got hormone imbalance, like especially perimenopause and menopause, often the way your gut is functioning maps to important ways for how your hormones are being produced and utilized.
Do you recommend daily probiotics?
Probiotics are interesting. What we know is that they do seem to modulate some of the signaling in the gut. Some of the old ideas that we had about probiotics, in terms of changing the composition of gut bacteria, those are more challenged with the science lately. I think that prebiotics actually have better literature behind them. And what I do with most of my patients is a combination of prebiotics plus probiotics.
Mm-hmm.
Are there ones that you like specifically?
I always ask what's the best science behind the different options that are available. And so one of the probiotics that I tend to use that is packaged together with a prebiotic is seed. I like to give a couple of different options. And so I also use some of the probiotics and prebiotics that are available from Metagenics, Designs for Health. There's a couple of supplement manufacturers that I think, follow good manufacturing practices and you actually get what's on the label. So those are a few that I like.
Which one of these supplements do you recommend at night and which ones do you recommend taking in the morning?
So at night, I often recommend phosphatidylserine. There's one supplement in particular that I really found to be helpful. That's a combination of phosphatidylserine with ashwagandha. And so I recommend that at night. It's called Cortisol Manager. It's by a company named Integrative Therapeutics. And then in terms of a combination of prebiotics and probiotics, I think it's reasonable to take those before you go to bed because you've got bowel rest overnight. I think that can be a helpful time to take it. You can also take it first thing in the morning. I'm a fan as well of fermented vegetables. So taking sauerkraut, 4 forkfuls a day of sauerkraut, kimchi, other fermented vegetables that can really help you with modulating the bacteria in your gut.
And can we just talk about food? You've written a book, Women in Food, but then also and it was a ketogenic diet. So I'd love to know your thoughts on the ketogenic diet. Also, your thoughts on intermittent fasting for women. There's some people that say don't do it, especially when you're going in perimenopause and menopause, because you need the protein. So I'd love to just talk for a minute about that, the diets that you sort of recommend to your patients and why.
The ketogenic diet was interesting for me because I tried keto about 10 years ago and I didn't find it was very helpful. I had a similar picture to you, Dr. A. I had insulin resistance, a fair amount of inflammation, and sky high cortisol. And so when I went on a ketogenic diet, the kind that's mostly been studied in men, I found that it wasn't that helpful for me. It actually increased inflammation, maybe even increased my insulin resistance a little too much. And so what happened over time is that I modified the ketogenic diet so that it's more female friendly. We know the traditional ketogenic diet, where you are getting most of your calories from fat, 70 to 80% of calories, and about 20% from protein and the remainder from carbs. That's associated with about 45% of women losing their menstrual cycle and changing their hormones in a way that can be somewhat adverse. So, can also cause thyroid dysregulation to be so low in carbohydrates. Women need some carbs because carbs help us with making serotonin, helping us sleep, helping us with thyroid function. And when you restrict carbs too much, it can cause cortisol to elevate. So you have to be a little careful about the way that you're eating. So I developed a ketogenic diet that I think is better for women, and it allows for more vegetable-based carbohydrates. And so, Dr. A, if you were my patient, I would put you on a trial of a ketogenic diet to see how we could work with your insulin resistance and see with N of one experiments what's going to be the most effective for you. So I was taught at Harvard Medical School that there's a hierarchy of scientific evidence. So the lowest quality is expert opinion. And then next is case studies and cohort series, and then observational studies like the Nurses' Health Study, and then the randomized trial. But the highest quality of evidence of all is the N of one experiment. And that's where you determine for yourself what's going to be the best course of action. So a ketogenic diet with a little more liberalization on carbohydrates, defining what your carb threshold would be. For instance, Dr. A, what's the level of carbohydrates that you can tolerate to improve function in your body, but not trigger a higher cortisol response? That's what I would be looking for, together with the continuous glucose monitor.
Okay, I'm coming to you.
And then,
She's the best. She's incredible. I know.
I need someone to check my blood from head to toe and tell me what to eat and what not to do. I have a question. What about insulin resistance and metformin versus berberine and,
GLP-1?
Not necessarily GLP-1s, but just like metformin versus natural supplements for insulin resistance, like for PCOS patients, let's say.
So I like to start with food because I think with my PCOS patients, I like to use a continuous glucose monitor. I think it just gives you immediate feedback on your food. And a lot of foods that people think are healthy, people who follow a Mediterranean diet, for example, they don't realize, if they're like me, that eating beans and legumes and hummus is elevating their glucose to really high levels. So I can't tolerate grains. The only kind of starchy foods that I can eat without spiking my glucose is squash. So winter squash does not trigger me. That kind of personalization, I think, is really helpful. So to answer your question about metformin versus berberine, I think berberine has so many positive qualities to it. It's antimicrobial. It helps with insulin resistance. It's associated with modest weight loss, typically of about 5 to 10 pounds over a period of time in women. So I usually start with berberine in someone who's got insulin resistance. The thing with metformin that's a little bit tricky, even though it's been hailed as a longevity drug, is that it can erode your zone 2 fitness. That's a whole other conversation too, but I really work with my patients to get regular exercise, to lift heavy, and to do a lot of zone 2 training. And so metformin can make it, not function so well in zone 2. So I tend to start with berberine. You get a lot of the same benefits as you get with metformin without the side effects.
And you think it's safe to take berberine for a long period of time?
So my approach with almost every supplement is to give a pulse of it. Mm-hmm. So a pulse for 6 to 8 weeks. And this is set up as an N of one experiment so that we really want to see if the supplement is making a difference. And with berberine, we think that from the liver effects, that it might be better to pulse it for 6 to 8 weeks and then come off of it for 2 to 4 weeks and then restart.
And what dose of berberine do you recommend for patients who are insulin resistant, PCOS patients, overweight patients, or patients with family history of diabetes?
So I typically start with 500 milligrams 3 times a day.
Okay.
Most herbs you got to take 3 times a day or else they're not going to be effective. So a lot of people have trouble being compliant with that kind of dosing, but that's what I recommend.
What are your thoughts on intermittent fasting?
So what I like about intermittent fasting is that it does help with the insulin signal. So people who've got this insulin resistance where their cells are numb to insulin, and it's something that I've had for the past 20 years, we think that intermittent fasting is a very effective way of dealing with that. The problem is when you look at women who are 40 plus, and we've got so much kind of baseline dysregulation that we're dealing with because of our hormonal changes. And then you tell us that we can't eat, until 12 o'clock, and then we have to finish eating by 6 or 8 p.m. That can cause more stress.
Yeah.
So this is a place where you have to individualize. You have to figure out, okay, what's going to be the best thing for the person. And that's where I think, again, wearing a continuous glucose monitor can be so helpful. And it can tell you, what's going on with fasting glucose. Let's do some N-of-1 experiments and see what's going to help a person. Is an intermittent fasting window that's more generous, like 12 hours, and then a 12-hour overnight rest. Is that better for this individual? It allows us to do these experiments so that we can personalize it.
I think 12 hours is easy. 16 hours is what gets me because when I wake up in the morning, I'm just hungry. I'm ready to eat.
Yeah.
You know,
you got to listen to your body. That's the whole point. You have to listen to your body. I don't get hungry until 11, and then I'm ravenous at 11. But to eat a breakfast for me, I drink a cup of coffee with some milk in it. But
then that you're breaking your fast.
I know, but I'm not trying to fast. That's my point. But I'm just saying, like, your body regulates itself, and if we, so many women have also lost the feeling of hunger, and what does that feel like? I don't know. I just think it's so much of what you talk about is every person is different, and you have to get your testing done. Look at your foods, the glucose monitor, all of these things to come up with this blueprint for what you should be doing. Because what you should be doing is probably not the same thing that I should be doing. And owning your health is what we're constantly saying. Like, become educated about your body so that you can then figure out yourself, whether it's to tell your doctor what you have or what you need to do, or work in tandem with a great doctor to change, so that you can live your best healthy life.
How can patients see you? Do you do Zooms or do they have to come in person to see you?
I do a lot of telehealth. So I've got licenses in a number of different states, California and New Jersey and Philadelphia, Pennsylvania. So I do a lot of telehealth, and then I also see patients in person.
And can you tell us where patients can find you?
So the best place to go is to the Marcus Institute of Integrative Health. That's where we have our executive program, and anyone can come see us there. So the precision medicine part of the executive program is what I run. And then the other place you can find me is on social media. So Instagram at Sara Gottfried, MD.
So for all the women listening, what are we at the end of every episode, we love to put tips on our website so that they can go. We're going to link to all of your books because everyone listening, each one of them is a gold mine. You should absolutely go get every single one of her books, and they're at different kind of phases of your life, which is interesting. And I haven't read the newest one, which I'm really excited to dig into. But what are the 5 things that you want every woman to know about their hormones? And it could be what tests they should take, what supplement you think every woman should. And I know, again, we've said this is precision medicine, and every woman is not, but just, what are the tips if you were going to give women 5 things that you've learned over this journey that they need to do? What would those be?
Number 1, test your hormones, especially if you're someone who's not having symptoms. So if you're a woman who's in her 20s or 30s or even early 40s, you don't know what we're talking about with all this dysregulation stuff, measure your hormones, because knowing what they look like when you feel regulated is really helpful later on. So measure your hormones, do it in a blood test, do it in a dried urine test, do it in a saliva test. Number 2, I think it's critical to personalize your food plan. I have a food first philosophy. We tend to be the kind of culture that reaches quickly for a pill, for metformin, or for even berberine, kind of a natural solution for insulin resistance. And I think we forget how much food can influence our body. There are parts of your gut where there's only one cell layer between the outside world that you bring in through your food and the inner life of your body. And we want to treat that with great sacredness. So, personalizing your food plan so that you're eating the food that most deeply nourishes you is critical.
Mhm.
I found personally that a continuous glucose monitor is essential to be able to do that. Even if you're not a diabetic, even if you don't have prediabetes, I found it to be so helpful.
Okay, great.
So, number 3 is exercise. I think what I would really want women to do, if I could change things, is I would get them to lift heavy weights as early as possible. A lot of women get afraid that they're going to bulk up, but women, for the most part, just don't do that. So lifting heavy, having that sense of power and agency, I think is so good for us. And I've got 2 daughters. One's 24, the other's 19. And I want them to lift heavy. It's so exciting to me when they do that.
Mhm.
So we all get, kind of the message about cardio and walking and hiking. And I would say lifting heavy is really critical. Number 4, sleep. So sleep is as close to a panacea as we have in medicine. It helps you avoid falling down a hormonal flight of stairs. And I think it's really important that you track your sleep. So I'm a fan of wearables. I use a lot of them because I use them with my patients, and it's part of the dashboard that I manage to help them optimize their health. And I think knowing when you wake up in the morning how much deep sleep you had, what your sleep score was, how much REM sleep you had, how many interruptions, what your heart rate variability was, that measure of the balance between your parasympathetic nervous system, stay and play, and your fight, flight, freeze sympathetic nervous system is critical. And then number 5, purpose and meaning. It is we know it's associated with health span. We know it's associated with longevity. It could be, a nonprofit. It could be a cause that you really believe in. It could be what you do for your career. It could be your children. It could be whatever you choose it to be. But we know that that's so important when it comes to, elevating us and buffering us, especially when we hit those more difficult, dysregulating times. So purpose and meaning is number 5.
Those are amazing.
Oh, no one can compete with number 5 with me.
I know.
The number 5 is keeping me alive from everything else I do wrong in my life.
Thank you so much for being here. You are incredible. We're going to have links to your books. We're going to have links to all the things that you recommend on today's podcast. You're just a wealth of
incredible.
knowledge.
I'm an OBGYN and I'm in an awe of you. Really. Thank you so much. You're amazing.
My
We
pleasure.
need more doctors
you.
like you. I wish you were in LA. I would have sent you every single patient of mine. You completely balance the way I practice medicine, which is unbelievable. I'm definitely going to be your patient.
Awesome.
Thanks,
Thanks, guys.
Take care.
Thanks so much for joining us today on SHEMD. And remember, if you want to own your health, a good place to start is by following us on social media at SHEMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
Check out takeaways from today's episode on our website, shemdpodcast.com. We'll see you next time on SHEMD.
This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SHEMD, some of the products and services we discuss may involve sponsorships or paid advertising.